Hello, my name's Aidan Richards. I'm a plastic surgeon based in the south of England, and I'm also the surgical director of Aurora Clinics. Now in this video I'm going to be talking about breast implant removal and replacement and the reasons why you may consider these. So more and more we're seeing patients who've had breast augmentation some years ago who have either developed problems with their implants or are wondering whether they should have them replaced. And you've got to remember that breast implants have been around really since the early 1960s, and some people who are perhaps in their 20s, in the 60s, are now getting to be more elderly, and as their body changes, they're considering their options for their implants. And I think as time goes by, we're going to see more and more patients with these sort of concerns. So the first thing is, generally, if you haven't got a problem with your bust, if it remains soft, it's not painful, there's no change in shape, and you're happy with how it sits on your overall physique, there's probably no real reason to consider exchange of your implants. Here at Aurora Clinics, we do, for all our patients, we do like to see them yearly. So every breast augmentation patient, we encourage them to come back yearly, just so that we can assess the area. If they've got any problems, we can discuss it. And if necessary, we can arrange for some investigations, which would normally be an ultrasound or an MRI scan, which would look at the implant, look at the shell of the implant, and just check that everything's okay with it. So if you have got any concerns, I would suggest that you do go and see a plastic surgeon to assess the area and discuss the best way forward for you, and perhaps arrange some of those imaging MRIs or ultrasounds which I discussed. So if you haven't got a problem, don't worry too much. Breast implants aren't going to cause you any concern. If you would like further information about breast implants, please contact us, and we've got a government guideline book which we can send you, which summarises all the medical studies about breast implants, the long-term complications, discusses the risk of developing other autoimmune diseases and possibly breast cancer, and also screening. I mean, studies have shown that there's no association, but if you'd like to be reassured, if you'd like the government booklet, please ring us and we'll be happy to send that to you. Now, some people do decide they would like their implants changed. Most manufacturers do recommend that implants are changed after 15 years. It isn't absolutely 100% necessary if you haven't got a problem, but some people do opt to have their implants replaced every 15 years. And that's fine if you feel happier with that. And again, we can discuss this with you if you come in and have a chat with us. We'll discuss the pros and cons. Now, many people who do decide to have their implants changed do so because they've either developed a problem with the breast implants, they don't feel they fit in with their overall physique, or they'd like to change the size. So you may want to decrease the size as you get older, and you may want to increase the size possibly, or may want to consider a procedure such as a breast uplift if you feel that the implants have descended and you've got, the skin has become rather loose on the areas. A breast uplift is a procedure called a mastopexy or breast uplift procedure, which I've talked about in other videos which you can see. And you can actually see me removing, exchanging implants, performing breast uplift procedures in the other operative videos which are available on the site. So I hope that's been a quick summary of some of the problems you can have and some of the reasons for exchanging your implants. In subsequent videos, I'm going to be talking about implant removal, if that's what you decide to have, implant exchange, if you decide to either have a new implant or a different size or shape implant. And in other videos, I'm going to be talking about what can be done if you have developed an abnormality in the breast. Maybe that would be a breast capsule formation. What are the options for treating those? So thanks very much for watching the video. I hope you found it useful and informative. We'd love any feedback on any of the videos or the website. If you've got any questions, please email us and we'll be happy to answer them for you, or schedule a free consultation with one of our specialist surgeons if you feel that's appropriate. So again, thanks for watching the video. I hope you'll be able to watch more videos in our series.